I'm Diane, and I survived an ischemic stroke. My initial symptoms when I started having my stroke were really strange. I didn't have the weakness on either side. I didn't have droopiness or slurred speech. I just didn't feel right. Just like, I thought I was getting the flu or something. I watched TV. I fell asleep then on the couch until my husband came down.
Before Diane's stroke, I did know something about the signs of a stroke. And I thought of that when she first complained of some dizziness and nausea.
First he said, well, go to Glens Falls Hospital, because that's where I had worked. But I got up and I was very dizzy.
It got worse. And I thought, there's no way we're going to be in a car for 40 minutes.
Then I think he got a little nervous. That was probably the first time he called an ambulance. I don't remember a lot from that point on. I remember pieces. They did many tests at the outlying hospital, and eventually they determined that I was having a basilar stroke.
I was with her at the hospital where she was diagnosed, and the transfer happened by a helicopter.
And I was the luckiest person in the world that I had the good fortune of having Dr. Ali Paul waiting for me on the roof.
Stroke isn't a medical emergency, and so we know that time is brain. Strokes of the posterior circulation or the basilar artery typically present differently than strokes of the anterior circulation and can be more difficult to diagnose. And that's exactly what happened in Diane's case. So when someone comes to the hospital and we're concerned they're having a stroke, they go emergently for a CT scan of the head, and then also for a CT angiogram, which looks at the blood vessels to see if there's a potential target for an endovascular surgery. SOFIA is really the catheter that allowed me to do aspiration thrombectomy first. Otherwise, I was previously always using a stent retriever, but because the SOFIA so reliably got to the clot and successfully removed the clot, I was able to transition to an aspiration-first practice.
I was there probably an hour before the procedure was finished, and the two physicians came out. So they gave the good news that things went as they wanted it to. I sat down on a chair next to her and I said, Diane, I'm here. This is Larry. And she turned to me and said, oh, hi, Larry. Hey, I'm okay. That's not what I expected.
You wouldn't know that I had a stroke. And from everything that I've read through my charts and my talking with them, it was a pretty serious, large stroke.
So Diane had an ischemic stroke, which is a type of stroke where there's not enough blood flow going to certain parts of the brain, and those parts of the brain have cells die because they're not able to get the oxygen they need from the blood. If
you think you are having a stroke, access the healthcare system immediately. I was dizzy 3 days before. I didn't put it together. So I think fast, is the best thing that anyone can do if they think they're having a stroke.
So recognizing the signs and symptoms of stroke can help save a life. The American Heart Association has produced the mnemonic Be Fast, which stands for balance, eyes, face, arm, speech, and time. And so those things are really the main clues that someone's having a stroke.
They saved my life. I was in tough shape. And people look at me now and they're like, you didn't have a stroke. And oh, I most assuredly did. Look at me. I mean, I am the luckiest person. I am so grateful. I am so grateful.